Growing old is a journey every human faces, but what often remains hidden is how the medical world really views seniors. Doctors, nurses, and healthcare staff may smile and provide care, but behind the scenes, many hold unspoken thoughts about elderly patients. These thoughts are not always pleasant. They can be harsh, uncomfortable, and sometimes even unfair. In today's video, we'll uncover 5 ugly truths doctors often think about older people, but rarely say out loud. These truths are not meant to shame anyone, but to open your eyes so you can protect your dignity, health, and independence as you age. If you're over 60, or if you love someone who is, this video is a must-watch. Let's dive straight in. Ugly truth number 1. Many doctors secretly believe seniors waste their time. One of the hardest things to hear is this. Many doctors feel frustrated when elderly patients visit them.
Why?
Because seniors often come with multiple health problems at once. Instead of one simple issue like a sore throat, older people may report chest pain, memory problems, joint pain, trouble sleeping, and dizziness, all in a single appointment. Doctors often think, this is going to take too long. The truth is, the modern healthcare system is designed for speed, not depth. Appointments are short, sometimes only 10 to 15 minutes. Younger patients with one simple problem are easier to treat. But older patients? They require patience, time, and compassion. Sadly, not every doctor is willing to give that. Some even believe seniors don't listen to advice. They prescribe medications, but the patient forgets, misunderstands, or mixes them up. Deep down, this makes some doctors feel their time is wasted. But here's what seniors must remember. Your health is not a waste of anyone's time. You've paid taxes, contributed to society, and deserve full care. If a doctor treats you like a burden, you have every right to find a more respectful provider. Ugly truth number 2. Doctors often think older people are stubborn and difficult. Doctors often complain that seniors are the most difficult patients.
Why?
Because older people tend to resist change. For example, a doctor suggests quitting smoking at 70. The patient says, I've smoked for 50 years, why stop now? A doctor recommends a new diet for diabetes. The patient replies, I've eaten this way all my life, I'm not changing. A doctor prescribes an exercise routine. The patient says, I'm too old to start now. This stubbornness frustrates many healthcare professionals. They feel seniors don't cooperate with modern medicine. Some even think, why bother giving advice? They won't follow it anyway. But here's the truth. This stubbornness is often not rebellion. It's fear. Change is hard at any age, but especially after decades of living a certain way. Seniors are not difficult. They just need more guidance, patience, and understanding. The ugly truth is, many doctors don't have the patience. Instead of encouraging seniors step by step, they label them non-compliant. If you're an older adult, the lesson is this. Try to show your doctor you're open to learning. Even small changes can impress them and improve your health. And if your doctor dismisses you as stubborn, find one who respects your effort. Ugly truth number 3. Doctors sometimes see seniors as walking drug cabinets. Another harsh reality is that older people are often seen as polypharmacy patients, meaning they take a long list of medications at once. Blood pressure pills, diabetes medication, cholesterol drugs, painkillers, sleeping pills, the list goes on. Doctors sometimes secretly think, this patient is a mess of medications. Which one is actually helping? Older people often see multiple specialists, one for the heart, one for the bones, one for the stomach. Each prescribes more pills, without checking how they interact. By the time the patient sees their family doctor, they might be taking 10 or more medications daily. Doctors know this is dangerous. Mixing too many drugs can cause dizziness, falls, memory problems, and even death. But here's the ugly truth. Instead of carefully fixing the problem, some doctors just add more pills to the list.
Why?
Because it's faster than carefully reviewing every medication. Behind closed doors, many doctors even joke about seniors rattling like pill bottles. This is a sad reality. Older people are often overmedicated, not because they need it, but because the system is too rushed to slow down and clean up the list. The lesson? Ask your doctor for a medication review at least once a year. Challenge them. Do I still need all of these pills? A good doctor will respect this question. Ugly truth number 4. Many doctors quietly assume seniors won't live much longer. Here's a truth few doctors will admit. Many secretly assume seniors are near the end of life, so they don't try as hard. For example, a 40-year-old with chest pain may be sent for every test available. A 78-year-old with the same pain might just be told, "It's probably nothing serious. Take these pills and rest." Why the difference? Because deep down, some doctors think, at their age, what's the point of aggressive treatment? They won't live much longer anyway. This attitude is dangerous. It leads to misdiagnoses, ignored symptoms, and lower quality care. Older people deserve the same chance at treatment as anyone else. In fact, many seniors today live active lives well into their 80s and 90s. Some are healthier than people 20 years younger. But if doctors secretly assume you're too old, they may not fight for your health the way they should. The lesson? Never accept being brushed aside. If your doctor ignores your concerns, demand a second opinion. You are not just old. You are alive, and every day of your life matters. Ugly truth number 5. Doctors often forget seniors are people, not just patients. Perhaps the ugliest truth of all is this. In the busy, pressured medical world, seniors are often treated as cases, not people.
Doctors may see
the hip fracture in room 12, the dementia patient in bed 3, the diabetic with foot ulcers. They forget these are living, breathing humans with stories, families, dreams, and dignity. Older people often feel invisible in hospitals. Doctors may talk more to their children than to them directly. They may lower their voices, as if the senior isn't capable of understanding. Some even treat seniors like children, using overly simple language. This dehumanization is deeply painful. Seniors deserve to be treated as full adults with wisdom and experience, not as burdens or bed numbers. The lesson? Speak up. When you go to the doctor, remind them, I want to be addressed directly. Bring a notebook, ask questions, and make eye contact. Force them to see you as a person, not just a medical chart. Conclusion. What seniors must do about these ugly truths. So now you know. 1. Many doctors think seniors waste their time. 2. They believe seniors are stubborn and difficult. 3. They often see seniors as walking drug cabinets. 4. They assume seniors won't live much longer, so care is minimized. 5. They forget seniors are people, not just patients. These are the 5 ugly truths every senior must hear. But here's the good news. Knowledge is power. If you understand how some doctors really think, you can protect yourself. You can demand respect, ask sharper questions, and choose doctors who value your life at every stage. Growing old is not a weakness. It is a victory. You've survived, you've lived, and you still matter. Don't let anyone, especially a doctor, make you feel otherwise.